Hey everybody, it's Dr. Dave, Psychiatry. Thanks for coming to the YouTube channel today, reminding you that if medicine fixes your problem, that makes it medical, not mental. Got a comment recently from a viewer that asked a very good question. The question was, have gained a lot of weight, taken Zoloft. Is it possible to gain or lose weight on Zoloft? So really, this isn't about Zoloft. This is about anything that you take that's for your brain chemistry that might cause a problem with weight gain. So addressing that question specifically, hey, if you believe that you have gained weight because of a medicine, why would that happen? And is it possible to lose weight even if you're on that medicine because it's helping you? And the answer is absolutely yes. You can lose weight when you take Zoloft. You can lose weight when you take any number of medicines that are said to cause weight gain. Here is the thing that you have to remember. There's an accident chain with weight gain, and the accident chain sounds like this. You have a normal appetite, you take a medicine that increases your appetite or decreases your fullness signal, and then you eat more, and then you gain weight. So notice the accident chain is not have a normal appetite, take a medicine, gain weight. There's the increased appetite thing that has to happen in the middle, or the change in satiety, the change in getting the sense of getting full. So I've talked about this on previous videos. I'll just repeat it. The issue is that anybody who eats more than they should is going to gain weight. People argue all the time that's not true. They say, look, no matter what I do, doc, I'm still gaining weight even though I eat almost nothing. Most times when people say this stuff, they're not tracking calories. So you have to know what you put in your mouth. My favorite thing that I use is MyFitnessPal to keep track of my calories when I keep track of my calories, which sometimes is difficult because, honestly, I'm like any other human. I like to eat. Food is good. So when you are struggling with your weight and gaining weight is an issue, if you are taking a medicine, that causes you to be hungrier. And if you give in to that desire, then you are going to eat more and you're going to gain weight. But if you are hungrier and you don't put more calories in your mouth, you are not going to gain weight. I actually saw this guy today. Not going to identify him by name, but this is a patient who really impressed me with something last December. I think it was like a year ago. And he came and said, yeah, I've lost 9 pounds. And I said, wait, you're taking Zyprexa, you're taking olanzapine. That normally that makes people hungrier. He said, yeah, I'm hungry, but the fact is, I don't. Here, his quote was, I should get my glasses out. I don't have my glasses with me. The quote was, I stopped eating as much. I stopped drinking junk food. I stopped eating junk food and stopped drinking sugary drinks, and I've lost 9 pounds. He said, the weight just falls off when you stop eating too much. So that is a living example of a guy who basically had to change what he put in his mouth despite the fact that he was hungry. So notice I'm not saying it's easy. It's not easy having a strong appetite. As I'm talking to you right now, I'm thinking about what I'm going to eat next because I'm just always hungry. So I'm not saying it's easy, but I am saying that if you are taking a medicine, whether it's Cymbalta, Zoloft, Prozac, Paxil, Lexapro, Zyprexa, Risperdal, name them. Name any of the ones that you might. For sleep, Remeron, Seroquel. If you are taking anything that makes you hungrier or makes it less likely for you to be full, it's going to be a bigger problem. But if you limit what you put in your mouth and you eat a normal or somewhat slightly less than normal calories for your age and activity level and body weight, then yes, you can lose weight. And people come in my office all the time telling me that they've lost weight while on medicines that, quote, cause weight gain. So the trick there is don't bite off on the hook that medicines cause weight gain. There's an accident chain there, and you can interrupt that chain by not putting the food in your mouth. Now, the other thing that's true is that some people are stress eaters. Some people eat because they're stressed out. They turn to food for comfort. And so a lot of people, especially early on, not this guy that I was talking about today, but early on when I was using Zyprexa with people, when other doctors would not use Zyprexa or Zoloft or Paxil or Lexapro because, hey, those medicines might cause you to gain weight. Well, what I learned early on is that people who stress eat and eat too much and snack out of nervous habit, they gain weight, and when they feel better, whether from their depression, their anxiety, their overthinking, their worry, when they feel better, they don't turn to food for comfort, and so they lose weight as well. So there's really several aspects of this, but the bottom line is that, yes, if you're taking Zoloft, you can lose weight while you're taking Zoloft. It's pretty simple. Got to eat less, and remember, that includes calories that you drink. What you put into your body matters, and if you're not keeping track of it, you might just have to. So that's what I have to say about that comment today. Thanks for your comments on the YouTube channel. We get a lot of those. Because I have a full-time private practice, I'm actually finding that really don't have time to answer the comments as effectively as I'd like to, but we are getting lots of comments on the channel, and I appreciate that. So it shows that people are interested, and I'm hopeful that it's helpful to all you guys. So I'm Dr. Dave Psychiatry. Thanks for coming to see me today.